Hi, it's Ed from Instant Physio. Today we're talking about what to do if your knee doesn't get better. Now, lots of people have knee pain and it settles down with time, with rest, and it can get back to activity. But sometimes people get stuck with a problem that just doesn't go away. So they might hurt their knee, they might just gradually start to get knee pain for one day for some reason, and it just doesn't shift. No matter what they do, they rest, they try stretches, they try physio, they try loads of other stuff, footwear, changing lots of things, lots of pills, potions, straps, braces, just doesn't get better. And sometimes that can go on for months, for sometimes years, and it might be more of like what we call a boom bust type of knee pain, where as soon as they go back to what they like to be able to do, for example running, it just comes back and they get stuck in this cycle. So today I'm going to break down what I would do in that situation if I saw a patient who is in that cycle, and to give you an idea of how we get someone back to a level where they can go back to normal. My name's Ed. I run a physio practice in Southwest London, specializing in treating knee pain. So the first thing that we would want to do is do a full assessment. So a big reason why someone doesn't get better with knee pain is often due to an old injury. So let me explain. There was a gentleman who came to see me, who'd dislocated his hip when he was younger, and it settled down, it healed and didn't really have any issues from it. And then he came in with this knee problem, and he'd been seeing another physio and had tried loads of things for quite a long period of time, and they'd focused so closely on the knee, they'd kind of missed some of the things that were going on higher up in his leg. Now, like I said, the injury had healed, obviously from that hip injury when he was younger. The legacy of it was still there. So we had lots of muscle weakness, we had really poor control through his hip, and they were some of the big things that we addressed, because his knee was functioning quite nicely. Quads were nice and strong, range of motion was good, there was no swelling. So we had to look further afield, and previous injuries is something that we really pay a lot of attention to, because if one area of the body is not taking up the slack and isn't doing the work because of an old injury, it means other areas in the body may well take up the slack and work harder, basically. So unless we address that kind of mechanism would still continue to happen. Another example is a sprained ankle. Someone might not want to push off through the front of their foot, even though the ankle is healed, forcing the calf to not be able to do work. And sometimes that can mean muscles higher up in the leg might start to do more work, or just generally the biomechanics and the function predispose the knee to more work, basically. Second thing we would want to do is really look at what that person's been doing with their exercises, with their rehabilitation, to try and treat that knee pain. We have a 5-step method. So we go through action planning, treating the short-term symptoms, treating the root cause, return to play tests, and prevent and protect. Now, lots of people get stuck in the pain relief stage, which is what we would call step 2. And that's where we're doing all the work to calm the pain down. Certain exercises can help with that. Straps, taping, ice, heat, lots of other things can help take away pain. And that's for us to enable us to go to a level where we can treat the root cause. So the pain's less, so we can do more aggressive things in the gym to load the knee so that it gets better. But if people don't go on to that level where we're stressing the knee so that it adapts to what we're asking it to do, they just get stuck in this kind of pain relief cycle where they do the things that take the pain away, but the knee doesn't really improve. They go back to trying a run or a sport or whatever it is they want to do. It hurts. They go back to the pain relief stuff, and it just doesn't improve, basically. So that's something that we would want to be looking into in terms of their previous treatment. And other times people can skip that level, so they're in lots of pain, but maybe they're just working on like more aggressive stuff too early, and every time they try and do their home exercises or rehabilitation, it just gets really angry, and that is a reason why their treatment can fail as well. Another reason why treatment can fail is because of people missing out on step 4. Now that would be what we call a return to play tests, return to activity tests, and this is where we're measuring where someone is at that moment compared to where they want to be, and making sure that that's at the same level, if not the person's higher and above what they need to be able to do. So a footballer, we would do certain tests to test power and agility, and we're looking for certain levels to be the same so that we can safely say that they're ready to return to football. And sometimes people get stuck in step 5 where they've made a load of progress, the problem's gone away, they've passed their return to play tests, and they've just stopped doing everything, thrown the rehab in the bin, they've stopped doing any exercises and any stuff to help their knee and maintain the progress they've made, gone back to sport, hell for leather, and because they haven't been continuing to maintain the work they've been working, it starts to hurt again, and then the problem comes back because they've just completely stopped doing what they were doing to help. Now, it doesn't mean you have to do exercises and rehabilitation for the rest of your life, but if you've had a long-term issue that is causing you a fair bit of bother, there's certain rules and routines that we would have to carry on doing, basically, to make sure that that person maintained their progress and stayed at a level where they were tolerating everything they needed to do. So in summary, the key things to think about when we're stuck with a knee problem that isn't going away, think about previous injuries, think about other areas of your body that may be underworking to make the knee overwork. Second thing is make sure that we're doing progressive loading, challenging rehabilitation to make sure that knee is getting stressed and it's adapting to what you need to be able to do. So that's probably where you'd need the help of a physiotherapist, in all honesty. But we need to make sure that the work someone's doing in their home exercise program is getting more and more challenging so that the knee continues to adapt and get more and more strong. Other things to think about would be making sure we're using some kind of testing to make sure that we actually have some evidence to demonstrate that the knee is ready to go back to sport, so that you don't just kind of guess it and just feel like it feels okay and then you go back to sport and it comes back. Once you're better, don't just stop everything. Keep going with your rehabilitation. Anything that was helping, you need to just carry on for at least 3 months, and preferably just on an ongoing basis as well. Leave a question in the comments box if you have any questions that you'd like to ask me, and I'd be happy to help. Look forward to seeing you on the next video. Don't forget to check out this most recent video I did on knee pain about how to get better in the fastest time. I'll see you soon.